Outbreak on Governance, Peace and Security in the Horn of Africa. Allow me to thank the UNDP, with whom we have been collaborating very closely in many areas, including this one for COVID-19 response. My name is Ahmed Ogwel Ouma. I'm Deputy Director at Africa CDC, a specialized agency of the Africa Union. So today, we would like to launch the first edition of the publication titled Impact of the COVID-19 Outbreak on Governance, Peace and Security in the Horn of Africa. This particular webinar intends to provide some highlights on what we have seen as some of the key things that have impacted governance, peace and security in the Horn of Africa during this time of COVID-19. We have a very distinguished panel, and at this time, I would like to request all those who are online, please mute your mics when you are not on the floor to avoid interference from different people who may have their mics on. To minimize interference, please mute your mics. I would like to first request Philiet Macheza to take the floor. Philiet is the Governance and Peacebuilding Coordinator at the UNDP Regional Service Center for Africa. Philiet has over 30 years of experience and has worked extensively as an international consultant providing support to governments, UN agencies, and civil society organizations in governance, peacebuilding, and anti-corruption. Originally from Zimbabwe, Philiet holds an LLB honors degree from the University of Zimbabwe and a Masters of International Law in Human Rights from the Raoul Wallenberg Institute of Human Rights and Humanitarian Law at the University of Lund in Sweden. Philiet, welcome, and you have the floor.
Thank you, Ambassador. May I acknowledge all your excellencies, the ambassadors who are present, our experts, and the researchers who have made this webinar a success. Today we are going to listen or to hear about the findings in the studies that have been conducted on the impact of COVID-19.
Les conclusions et recommandations des études qui ont été menées en matière de paix, sécurité, gouvernance dans le contexte de la crise.
Yet the discussion remains current and as relevant today as though views and opinions. It's not surprising, for example, that we now tend to use the term governance preceded by some adjectives, including common ones such as good governance, democratic governance, accountable governance, and inclusive governance. To try and get a common framework, UNDP in a 1997 policy paper defined governance as the exercise of political, economic, and administrative authority to manage a country's affairs at all levels. It comprises the mechanisms, processes, and institutions through which citizens and groups articulate their interests, exercise their legal rights, and meet their obligations and mediate their differences. It is my pleasure today to open this webinar and for us really to hear from the first launch of this series of studies how governance, peace, and security were adversely affected by COVID-19, which initially appeared as a health issue, but which soon revealed that there were other cracks in society and that our already weak governance structures in Africa were tested beyond capacity and our preparedness. Thank you very much. And with these few words, I would like to declare the webinar open. Thank you.
Thank you very much, Affiliate, for flagging us off. And we appreciate your very clear definitions of what governance is all about. And I think we'll bear this in mind as we continue with our discussion. So for those who are joining us now, we have interpretation facilities. And if you go to the bottom of your Zoom screen, you will see the button that says interpretation. You can choose either English or French, depending on your preference. And so we encourage people to utilize that particular interpretation facility. We also have both a chat and a Q&A function, again, at the bottom of your screen. Please utilize those. For the chat, you share your thoughts. For the Q&A, let us reserve that for those who will have questions during this particular webinar. In terms of process, we will have all the presenters make their presentations, and then you can be able to ask your questions using the Q&A function and share your thoughts using the chat box. And colleagues will be collating those for purposes of response by the panelists. I would like now to shift to our next presenter, who is Jide. Jide Okeke is a regional program, works for the regional program for Africa at UNDP, a regional service center for Africa. He has more than 15 years of experience, and he has worked for leading academic and research institutions, including international and regional organizations, as well as government. He has been lending his expertise on governance, peace and security across more than 20 countries in Africa. Recently, he was head of the policy development and civilian coordination on peace operations at the Africa Union Commission in Addis, before moving to his current position at the UNDP. Mr. Okeke holds a master's in public administration from Harvard University and a Master of Art in conflict resolution from Bradford, as well as a PhD in development politics from Leeds University in the UK. And today, Jide is going to take us through highlights on the impact of COVID-19 on governance, the paper, the publication that we are launching. So Jide, the floor is yours.
Thank you very much, Dr. Ahmed, and good afternoon and good morning to colleagues wherever you are. I would like to recall how we came up with this idea. The idea was given birth by Dr. Ahmed when we initially reached out to him to ask how we can support the Africa CDC in its COVID response. Following the birth of the idea, of course, Philip and his team leading our governance work at the Regional Service Center alongside Dolberg Advisors decided to realize the idea. So I have the very simple task of reporting some of the findings that came out of the report with respect to the Horn of Africa. And this is one out of a series of analysis that is ongoing. In terms of what I intend to cover today, I would be taking you through a journey that would, of course, touch on some of the immediate health implications of COVID-19, but more crucially, highlighting some of the findings that we are beginning to see in relation to governance in the Horn of Africa, and giving the peculiarity of the region as it relates to peace and security, would also offer some of our reflections of what is emerging from this report. In terms of the general pattern, I think Africa CDC knows this more than we do. As at yesterday, in the Horn of Africa, we've seen over 56,000 cases, confirmed cases. And if you look at the graph, we are seeing a geometrical increase in the number of confirmed cases. And this is despite very limited testing being conducted. I think the expectation, I was listening to the director of Africa CDC yesterday, the expectation is that Africa should be testing 1.3 million people every month. If you look at what is happening in Ethiopia, so far Ethiopia has tested over 400,000 despite its population of over 100 million. There is a fall in that regard. So if more tests are conducted, it is likely that we would, of course, see more confirmed cases. But the good news coming out of all of this is that the death rate has been relatively low, less than 3%. And more so, we are also saying that in terms of the cases that we reviewed across the Horn of Africa, including Tanzania, only 50% of the countries have cases of over 5,000. And this is quite commendable, but as lockdown begin to ease, we may begin to see some increase in the numbers as we go along. How has government responded to the crisis, to the pandemic? I think we have seen, and from the studies we've seen, that there has been a combination of both non-pharmaceutical and pharmaceutical measures. And this is very much, as we have highlighted here, a number of lockdown measures and social distancing are in place. But we are also seeing that there is a gradual lifting of some of the measures across the countries. And this is likely to lead to potential contaminations. In terms of the immediate economic crisis, and our team, our SAT team in New York has done quite a lot of work on this, as well as ECA and quite recently McKinsey. Prior to the conflict, prior to the pandemic rather, the region was on a path to a further reduction in the scale of poverty. And this is something that the initial forecast demonstrated. However, with the COVID pandemic, we are likely to see a reversal in this trend, and not just a reversal, we are likely to see an increase in poverty levels. And this is very much demonstrated in the forecast that has been made by the IMF, the World Bank, and as well as, of course, at the UNDP. And so this is a big source of concern. And one of the main areas where livelihoods is most affected in the Horn of Africa is around food security. We have seen a 19% increase in the extent to which people in the region are experiencing food insecurity. And this is a big source of concern, and one that could lead to intercommunal tensions, less so because of greed, but more because of economic grievances that some of these communities may face. Moving down to governance, the implication of governance, we saw that Phil touched on provided a conceptual overview of our notion of governance. That is not exhaustively reflected in this study. We have simply highlighted some of the indicators around governance and how that is being affected in the region. And the overall impact on governance in the Horn of Africa is that we are seeing that it is quite limited. But this does not tell us the entire story. As we begin to look at some of the specific indicators, one would really see the scale of or the impact of COVID on governance. If you look, for instance, at the progress on political reform, here there is a mixed bag. We are seeing that, for instance, that due to reduced government budgets across some of the ongoing political reform, this would affect the extent to which progress can be made. We have also seen in relation to elections that there has been some postponement. But in the case of Tanzania, it's also important to note that elections would go ahead. So it's a mixed bag around, especially when you look at the indicator around political reform. Where we see potentially high impact around governance is on transparency and accountability. In the immediate term, we are seeing that there is limited trust, especially in the types of information that government is providing to their citizens. And that is, of course, hampered by the nature of the social contract between the state and citizens. This could likely worsen as the crisis becomes sustained. One of the main areas where we have seen a very high impact of COVID on governance is around government effectiveness. As many of you may know, most of the non-essential services have been halted in most government ministries. Some government workers have had to leave work remotely, and that effectively has constrained the ability of government to provide services to their citizens. We are also seeing that because of the non-pharmaceutical interventions that have been imposed in the region, that has led to some incidents of brutality by law enforcement. And if then one goes back, I turn to the impact that we see around the peace and security of the Horn of Africa. Here, there are a number of points to note. The overall situation in the Horn of Africa has not radically or qualitatively changed from the pre-COVID times. But there is, if timely interventions are not put in place, we could see that this could deepen or worsen. In that regard, we looked at a number of indicators here. The first is the implication of COVID on political insecurity. And despite the fact that in the immediate, we did not see major changes to politically motivated insecurity that could be specifically linked to COVID, it is likely that COVID may worsen tensions that some of which are pre-existing. In relation to civil unrest, we have learned quite, through this crisis that one of the major debates is around the tension between saving lives and also searching for livelihoods. In the course of some of the strict measures that have been imposed by government and the anticipation of widespread food insecurity, we are likely going to see more social tensions. And of course, all of this cannot be, this narrative cannot be complete if we do not talk about the impact on women in the region. And here, UNFPA has done a very good analysis on how COVID is affecting or increasing the levels of domestic violence against women. And we are also seeing that women have reduced access to healthcare. Besides, in our report, we noted that 70% of frontline health workers are women, and they are constantly exposed to the risk of infections. In terms of intercommunal tension, I think I've touched on this and how food insecurity could lead to that. Al-Shabaab is a major threat in the Horn of Africa, and it has consistently exploited COVID to improve its standing, but also to try and recruit more vulnerable people. And this is likely to continue. We are also seeing that in terms of the humanitarian situation, 6.3 million people in the region are currently refugees, are currently IDPs, and 3.5 million people are refugees. According to our estimation and based on some of the studies that we reviewed for this brief, this could likely increase by at least 10%. One area of work where we have seen no major source of tension, but this could change if the pandemic persists or its implications worsen, is around cross-border conflicts. And this is one aspect that we note. I would come back to this point later. In terms of how COVID specifically has increased conflict in the region, this has been quite limited. According to the data that we reviewed, only 6% of incidents around insecurity were specifically linked to the COVID pandemic. And this is something that we should also note. Not to say that, of course, there isn't conflict, protest, and violent events in the region, but to highlight that the specific nexus between COVID and these incidents are relatively low. I go on quite quickly to what we're seeing in terms of bilateral relations. We see here that COVID has not necessarily impacted on the pre-existing relationship between states in the region. We see that, for instance, there are subtle tensions between or clashes across borders, for instance, between Sudan and Ethiopia. But there's also an improvement of relations between some countries, notably Ethiopia and Somalia. What should we look out for around the borderlands? I think it's important that we stress this point. Despite the fact that we are not necessarily seeing this high level of relationship or positive relationship between COVID and conflicts, there are certain conflicts that are pre-existing that could be worsened through the COVID pandemic. And here we make three main, we make reference to three specific cases. The first is the Mandera Triangle, which is a triangle between Kenya, Somalia, and Ethiopia, where we have seen activities by Al-Shabaab, but also the Karamoja cluster and the Abyei region. And we are making the case that these are regions where we need to invest a lot more in order to avert the risk of greater insecurity. Regional response has been quite commendable. We have seen, this meeting is a testimony of how proactive the African Union has been in trying to provide a multidimensional response to the crisis. within the framework of the African Union strategy on COVID response. We have also seen that IGAD has and other regional economic communities and regional mechanisms have taken bold measures to address conflict, to address the pandemic, both from a pharmaceutical perspective, but a non-pharmaceutical angle as well. What do we propose? I think there are a set of recommendations that we are proposing to regional organizations. The first is the support that we really need to invest in to ensure that the ongoing political transitions that we see are sustained and are successful. So for instance, I would make specific reference to the ongoing negotiations between the federal government of Somalia and the federal member states. It's at a very crucial phase and one that needs to be supported and would define Somalia's security future. The second is that, we have seen a lot of commendable regional solidarity led by or pioneered by the Africa CDC. That should continue, both from a health perspective, but otherwise. So for instance, we're looking at an example of the Continental Procurement Portal that has been established by the Africa Union, by the Africa CDC, which needs to be operationalized in order to ensure coherence in health procurement. Not to forget, of course, the need to strengthen the contracts between state government and population. And I think Phil made this point at the opening of his, during his opening remarks. This is something that predates COVID, but COVID has also highlighted why this social contract has to be more than ever or has to be renewed. We also see the last few points I have before I conclude is the need for greater investment in food security. This is the second biggest challenge after COVID, and if one that could define the extent of stability in the region. And it is therefore extremely crucial that as we try to resolve this health crisis, we prioritize food security in the Horn of Africa. I would conclude by saying that Al-Shabaab is one that is not just a threat to Somalia, but could potentially be a threat to the region. And that is why there has to be a much more sustainable path to Somalia's security. One way through which that can happen, and which the African Union has been invested in, is by building the capacity of the Somalia National Army. Overall, this is our initial reflection, and we welcome comments to these findings. Thank you so much, and over to you, Dr. Ahmed.
Thank you very much, Julia, for that very clear, concise presentation. And I urge those of us who are online, if you have questions, please use the Q&A tab at the bottom of your Zoom link so that we can be able to collate these questions and answer them at the end of our presentations. Next, I would like to invite Ambassador Frederick Ngoga Gateretse, who is the head of Conflict Prevention and Early Warning Division of the Peace and Security Department of the Africa Union Commission. Ambassador Frederick is a Burundian national and is working currently with the Commission as head of the Conflict Prevention and Early Warning Division. And the division includes not only the Continental Early Warning System, but also the Panel of the Wise, as well as the AU Borders program. Prior to his current position, he worked as a senior officer with the Africa Union Mission in Somalia, famously known as AMISOM. He studied in France, as well as the United States of America, where he attended the University of Pennsylvania, Harvard University, and Suffolk University. He has received numerous professional trainings on peacekeeping and international security. with Harvard's John F. Kennedy School of Government, the African Center for Research and Study on Terrorism in Algeria, and the British Army's Defense Intelligence and Security Center in the UK. He was appointed Ambassador Extraordinaire and Plenipotentiary of the Republic of Burundi on the 16th of April in 2014. Ambassador Frederick, the floor is yours. Please unmute your mic, Ambassador, unmute your mic.
Thank you so much, Dr. Ahmed. First of all, good afternoon and distinguished guests. I'm pleased to join you all today for the launch of this important joint initiative by the AU Commission and UNDP Africa to assess the impact of COVID-19 on governance, peace, and security in Africa. I would like to first commend the Africa CDC for the remarkable job that they are doing. I think it's suffice to say that there is not a single African who's not proud of the work that has been put into fighting this pandemic. I would also like to thank the UNDP, which has always partnered with us, be it on this particular project, but also on matters related to climate, peace, and security. As the speakers before me have already highlighted, COVID-19 has posed multifaceted challenges to the peace and security landscape of the region. COVID-19 numbers in the East and Horn have been relatively low in comparison to the other regions, with almost 72,000 confirmed cases and 1,625 deaths in East Africa, according to the Africa CDC. The report that's being launched highlights that Kenya has confirmed the most cases and Sudan the most deaths, while Djibouti has the highest cases per capita. And Eritrea has yet to report any death, and Ethiopia's COVID numbers are steady on the rise. Since the outbreak, several member states in the region introduced various measures to proactively contain the spread of the virus. Some of the interventions focused on mobility, restrictions, social distancing, border closure, full and partial lockdowns, and provision of limited economic support. Said measures have since been relaxed in some countries, which will likely ease the negative impacts on livelihoods, but in turn put pressure on our overwhelmed and weak health systems. While COVID-19 runs its course in Africa, conflict prevention and mediation efforts have been affected. The virus has delayed the implementation of critical peace agreements and hampered our mediation efforts at the local level. A few of the efforts hampered by the pandemic include delays in the negotiations with armed groups in Sudan, the need to provide robust mediation, diplomatic and economic support to the established transitional government in South Sudan and Sudan. Furthermore, terrorist and non-state armed groups are also capitalizing on the pandemic to increase attacks. In the Horn of Africa, Al-Shabaab has continued to attack civilian populations in Somalia and in Kenya. While the spread of terrorism and extremism on the continent is worrisome, it is even more alarming to see terror groups leverage the outbreak of coronavirus to spread misinformation, as well as utilize diverse social media platforms to spread extremist ideology and foster recruitment. It is worth noting that a significant number of conflicts on the continent are resource-based, fueled by climatic shocks, structural governance deficits, and the lack of institutionalized dispute resolution mechanism. The COVID-19 environment is likely to exacerbate these tensions as communities grapple with government responses that directly affect their ability to feed their families. The most vulnerable will remain at risk, with 6.3 million IDPs and 3.5 million refugees and asylum seekers spread across the East Africa and Horn of Africa region. The virus has also resulted in the delay of political transitions in some countries. At least 15 member states across our continent were slated to hold elections through the end of 2020. The pandemic has raised crucial concerns over the organization of the elections within the stipulated time and in accordance with constitutional provisions. Political actors and citizens have been concerned with governments taking advantage of the pandemic to entrench themselves beyond their constitutional limits, while others called by citizens and political parties have asked for governments to postpone elections until the pandemic is contained as part of efforts to mitigate the spread of the virus. Ethiopia's general elections, originally scheduled for August 2020, have been postponed due to COVID-19, a decision that has sparked heavy debates among political actors. Somalia has also postponed its election for internal security due to internal security reasons, but COVID-19 is likely to contribute to the delay in reforms and related processes. As we speak, we're in the midst actually of a crisis over the delayed election in Somalia. While COVID-19 continues to pose multifaceted challenges across the continent, it also gives us the opportunity to be innovative and work as a unified collective to prevent and respond to security threats. A crisis is a terrible thing to waste, as they say. Today, when you look at the impact of COVID-19, its impact on livelihoods, the political disputes dwarfs compared to the threat posed to our common humanity. It is therefore our wish that going forward, we'll put our common humanity first, and that is why I would like to endorse some of the recommendations that have been given by the report, and we will be looking forward to implementing them together, not only at the African Union level, but also with IGAD and our other partners, including the United Nations, and particularly the United Nations Development Program. I thank you for your kind attention.
Thank you very much, Ambassador Frederick, for that very illuminating presentation. And I like your ending that humanity comes first. I hope that those who are fomenting conflict in the Horn of Africa, indeed the whole continent, would be able to hear that. Next, I would like to call upon Ms. Elwad Elmi Mohammed, who is a Senior Policy Officer, Women Rights, Women, Gender and Development Directorate at the Africa Union Commission. Ms. Elwad comes with more than 12 years of experience in legal and communication, as well as project management in human rights. She started her career at the French Ministry of Foreign Affairs in Paris, preparing the French policy on human rights and international law for the 62nd session of the UN General Assembly. She has strengthened her multicultural background by adding to her career the role of legal advisor to the program, UNDP's project to reinforce Djiboutian parliament and enhance its legislative capacity. She is deeply passionate about gender equality and has served as a senior women's rights officer, focal point for the Africa Women Leaders Network, AWLN, and the Pan-African Women Organization, PAO. She holds a master's degree in international law from the French University, Paris Sud 11 at Jean Moyer. Ms. Elwad, the floor is yours.
Merci beaucoup, Dr. Ahmed. Excellences, chers collègues, mesdames et messieurs, je tiens tout d'abord à féliciter le CDC Afrique et le PNUD Afrique pour ce rapport sur l'impact de la pandémie de COVID-19 sur la gouvernance, la paix et la sécurité dans la Corne de l'Afrique.
Technical webinar and launching this report, I would like to bring the gender perspective. There are two salient points regarding gender when considering impact of COVID-19 in the Horn of Africa. Firstly, it is the disproportionate impact of this pandemic on women and young girls. This is something that was highlighted in the study. Women will have suffered a multidimensional impact from this pandemic, and the gender gap has widened greatly. Second point, in order to make sure we can count on sustainable development and sustainable peace in the region, it is crucial to study the gender equality, especially when it concerns political participation, decision-making, and leadership of women in situations of crisis, including access to resource and income. And I regret seeing insufficient accent on this matter in the report. However, there are some things highlighted in this report. First off, the study shows that women make up for almost 70% of the frontline health workers. Women in the Horn of Africa are the main caretakers within the hospital, namely taking care of children or the elderly, more often than not without any paid, without any salary. Secondly, the report also mentions that women are economically very insecure. So when governments decide to close down shops or borders or schools where the majority of the employees are women, and these are sectors in the economy that have low income, we've all seen a rise on domestic violence within families and couples, whether in the Horn of Africa or worldwide for that matter. These numbers have been flagging. On the other hand, school shutdowns have unfortunately encouraged some old practices, thinking child marriage, incest, and sexual violence against children, and namely against young girls. I'd also like to mention some of the problems linked to the health system access for women, namely for maternal health services. More often than not, women are those who will need health services compared to men, and the rights to reproductive health are also quite affected. So I've noted that the report highlights a number of initiatives that are already been implemented at the regional and continental level. So within the Directorate of Women, Gender and Development within the African Union Commission, we are trying to help member states to mainstream and lower the gender gap between men and women and increase women's rights in all of the respects dedicated to fighting COVID-19 on the continent. We have provided a certain number of tools to better help women in various sectors, economical sectors, also in peace, security, agriculture, healthcare, education, and so on. So these guidelines will also call upon member states to align themselves to the contents of the African Charter Protocol on Human Rights and Peoples, namely the Maputo Protocol. In conclusion, I would say that it is fundamental to include the gender perspective in this COVID-19 impact report on governance, peace, and security in the Horn of Africa. The reason being, the more representative and inclusive the system gets, the higher chances we have of attaining peace and prosperity in the region. Thank you for your attention.
Thank you very much, Eduard, for bringing out that agenda perspective. I'm sure colleagues will be able to relook at the report to see how best to capture the gender angle even more clearly in the report. I would like now to call upon Ms. Mukondeleli Mpeiwa, Senior Policy Officer in the AU Mediation Support Unit. She has vast experience in peace and security, in the peace and security space. In addition to providing mediation policy support to the Africa Union, including the panel of the WISE, she also coordinates FemWise Africa, the 450-strong network of African women in mediation and conflict prevention. Prior to joining the Africa Union, Ms. Mpeiwa worked with the SADC Mediation Support Unit as a policy officer. She has previously worked with the International Organization for Migration as head of mission, amongst other capacities. Ms. Mpeiwa, the floor is yours.
Thank you very much and good afternoon, Dr. Ahmed and colleagues. Thank you for inviting me to share my remarks, but also for giving me a preview into the report, which I read with a lot of interest and enthusiasm. I think at the onset, it's important to recognize that globally, and indeed on the continent, we are in a warlike context as we fight coronavirus. I think many countries, because of their response and efforts to curb the spread of COVID-19, have gone into contexts of curfew, restricted movement, and minimal social and economic activity, which has also unfortunately had the undesired effect of affecting economic losses and other socioeconomic challenges that bring us here to this conversation today. I think building on my colleague Ilwad's inputs, I would like to look a little bit more at the impact on women and within the context of peace and security. I think the report has done a lot to highlight some of the socioeconomic and socio-political issues that are arising and framed them well within a governance and peace and security context that shows the interrelationships between the various sectors or angles through which we are looking at the issue. However, when we look at or talk about issues like public or violent protests, it's important to look also at their impact from a gender lens, where we see how women, for instance, are impacted beyond the violent protests or the public violence that we see. Why do I say this? Because in the context of the countries of the Horn of Africa, a lot of economic activity is informal, and informal traders are more often than not women, which means that when there are public protests, it's the women's livelihoods that are affected or sometimes even destroyed. And this has to come out very succinctly in the report in order for us to see the impact of some of these challenges in a disaggregated way that also allows us to make gender responsive or gender relevant policies and interventions. The report also talks about, on page 22 onwards, the prevalence of conflict-related sexual and gender-based violence. And I think this is important also within the context of the general gender-based violence problem that we have on the continent, but also specifically in the countries in the Horn of Africa. The big challenge around conflict-related sexual and gender-based violence here is its impact, its intergenerational impact on women and girls. We have seen in some other related studies how women are sometimes forced to take drastic measures like drinking bleach and basically drinking poison in order to ensure themselves against a possible pregnancy in the event that they are raped or sexually violated within a conflict context, but also increasingly just within the general GBV context of our societies. I think when we combine this with displacement, forced displacement, whether it's internal or a refugee context, the vulnerability is exponentially increased, because it means that in addition to inadequate socio-economic resources or provision, we also have the challenge of access to services, basic services, but especially sexual and reproductive health services for women and young women especially. This is a big challenge within a conflict context, but it's even worse in a conflict context where generally the social context doesn't provide for such essential services anyway. And I think this is the reality of the countries in the Horn of Africa predominantly. I think the interface or the intersectionality between culture, religion, and socialization generally also puts women in a difficult predicament when we are now also combining that with the effects of COVID-19 and proximity to abusers and also exposure, much more exposure to gender-based violence. Now that I have highlighted quite extensively the many challenges that the women, peace and security agenda faces in the face of COVID-19, I think it's also important for me to talk just briefly to opportunities. I think the fact that multilaterals are increasingly pushed out of the space because of the travel bans that are in place has created directly now an opportunity for grassroots actors, especially women and young people also, to take center stage in conflict resolution and conflict prevention initiatives in our societies. I think the social relations or social cohesion fabric is being mended through initiatives to around provision and manufacturing of PPE that is servicing our communities, and this is creating a sense of oneness against the common enemy. This also creates an opportunity for women to lead initiatives around conflict prevention and also building closer relationships that also foster early warning. I think that as multilaterals and other external entities, our role should be to focus on and put the spotlight on these initiatives, but also complement and support them, and where possible, enhance capacity so that these women and young people on the ground are able also to multiply the knowledge and also inculcate this culture of peace, which obviously requires us to have better connectivity and better access to technology, the internet, and so forth. But allow me to stop here by also thanking the authors of the report for highlighting some of the key issues that women are facing generally within the COVID context, but specifically within also the peace and security lens. I thank you.
Thank you very much, Ms. Mpewa, for giving us that focus on young people and women, particularly in the context of the community, from gender-based violence to conflict resolution and possible advantages in terms of economic activities. Having heard from all the panelists, I would like now to shift us to the question and answer session. We'll try and take in as many rounds of questions and answers as possible, time permitting, because we have another 30 minutes or so before we start closing the webinar. And thank you very much, panelists, for very good presentations, a lot of information there. So I'll start with the questions and answers. We are still collecting and collating the questions and answers and grouping them together for ease of being tackled by the panelists. The first question will be a bit broad, and I will ask any of the panelists to take that up. And for the panelists, please, very short answers so that we can take in as many questions as possible. The first question is looking at the current impact of COVID-19 on the youth and coupled with the already existing challenges of corruption. How can we address the issue of corruption in the context of COVID? Jide, although this did not come out clearly in the report, but I'm wondering whether any specific areas were covered around corruption in the context of COVID-19. And for the rest of the panelists, if you have thoughts around how do we tackle corruption in the context of COVID-19. I'll start with you, Jide, and then I'll go to the others. Jide?
Thank you so much. Extremely relevant question. When you look at the index and how some of the countries are faring around corruption, we probably would get to the consensus that they are not faring too well, right? And that is one of the aspects that we captured in the report, that the corruption perception index in most of the countries in the Horn of Africa before COVID is already a source of concern. And then when you include the challenge of COVID, what you find there is that there is a high risk of further deterioration between in the social contract between state and citizens, especially around transparency in the utilization and distribution of resources. And this was very much evident in some of the countries that we reviewed. We saw this quite a lot in the case of Kenya and to some degree in the case of Somalia. And so to a large extent, there is a policy recommendation that can emanate from that, which is that as we begin to see more interventions by government, there needs to be that deliberate consciousness to reduce the risk of further deterioration of the level of corruption in those countries. But that is one aspect that we found to be politically sensitive, and we couldn't necessarily provide very objective analysis in terms of the evidence that was coming from those countries. Over.
Thank you very much, Jide, for that. Maybe I can ask Ms. Mpewa, from the angle of the youth particularly, and looking at the fact that quite a number of them are not as occupied economically as would be the case when there were no lockdowns. Your thoughts on the link between inactive youth and corruption? Ms. Mpewa?
Dr. Ahmed, I think the question you are raising is a very pointed one, but not just the relationship between unoccupied youth and corruption, but unoccupied youth and conflict. I think one of the images we always see in countries where there are public or violent protests, as reflected in the report, is young men who are at the prime of their physical strength, marching in the streets, carrying weapons, whether it's sticks, stones, or other sorts of violent objects. And that tells you that these people have got too much time on their hands and pretty much nothing to lose from engaging in this unproductive violent activity. And of course, this level of desperation where physically you are willing to put yourself and your life at risk should tell you that the engagement in corrupt activities or unethical activities will be an easy and a natural one, because our youth have got nothing to look forward to and nothing to lose. I think we really, really have to start thinking outside of the box. The narrative of go to school, get a job, and be productive is clearly not going to take us into the future, because the economies are not producing enough opportunities for young people. How do we work around this and work with these young people to find solutions that allow them also to transition into adulthood in a manner that preserves their dignity and allows them also to optimize also their own existence? These are the challenges that we will be grappling with going forward.
Thank you, Ms. Mpewa. Maybe let's shift on to the next question. And this is on extremism. Looking at how extremists tap into existing challenges and inefficient service delivery, how can we fight extremism where they are the ones that are taking responsibility and providing some basic services in communities where they have control? I think I'll pass this on to Ambassador Frederick. How do we fight extremism, especially where service delivery is poor and they are the ones who are providing this service? And then I will ask Ilwad to answer that from the angle of particularly women being the ones who are most affected. But first, Ambassador Frederick. Thank you very much, Ambassador Frederick. Very, very well put. And Ilwad, if you can be able to see that the gap in service delivery, particularly from agenda perspective. Ilwad? Ilwad, are you still there? Maybe you're muted.
Yes, could you please ask your question once again? I did not catch it the first time.
It's okay, Edward. The question is, extremist groups have seen that there is a gap in providing basic services to the community, and are taking up that challenge to provide those basic services. How can we be able to fight extremism if they have taken responsibility of providing those services? And I would like you to look at it from the perspective of women who really are the ones who are most affected in this context. Ilwat?
Thank you. I would say that, as I was saying earlier, when women are present in decision-making within communities, within governments, or at national level, and generally speaking, as I was also saying earlier, when women are involved, actively involved, from the get-go, that is, and have proper recognition by being elected or chosen representative. This is something that is truly lacking, and not only in Africa, but across the continent. This would definitely feed into this understanding of things. And when we've had so many examples that prove this, so when women are present, they actually make a big difference in smoothing out differences within homes and communities. So what I'm basically saying is involve women in decision making. Thank you.
Thank you very much, Edward. And we'll go on to the third question now. And Jide, this is specifically for you. The question is, can we say that time has come for governments and regional bodies to develop joint strategies to mitigate not just COVID-19, but also other things like desert locusts and floods? Jide?
Thank you very much, Dr. Ahmed. Absolutely. I think this is one of the main lessons that the COVID pandemic is revealing. For the first time in 25 years, Africa would experience its first collective recession. And it is one that cannot be addressed through protectionism. And that is why I think what the Africa CDC has started is one that should be reinforced and supported, not just by other African countries, but by the international community. We have seen, for example, that through the African CDC's continental COVID response strategy, you have been able to mobilize countries to collectively fundraise and support the interventions that we need to undertake collectively as a continent. We have seen that through the leadership of the African Union, we now have special envoys that are specifically dedicated in a continental response towards an economic recovery that works. I think we are beginning to see this movement towards an economic solidarity amongst African countries. And if we have to think about what Ambassador Fred said about do not waste a crisis, I think we are, to a large extent, Africa is poised not to waste this crisis. And this is very much evident in some of the work that has been pioneered by the African Union. And now, what could be done better? Because not all has been done in the way that we think would reflect effectiveness. There has to be greater synergy between what is being done at the continental level and what the RECs are also trying to do within the sub-regional level. So you would find, for instance, that IGAD is playing an important role in its in undertaking some of these interventions at within the context of the Horn of Africa. We need to bridge that gap between what is happening at the continental level and what is happening at the sub-regional level. We also need to bridge the gap in terms of how international partners support some of these regional initiatives. It has to be done in a way that promotes coherence and not competition for resources. And this is why the leadership of the African Union will be very important in demonstrating that that coherence can be achieved within Africa. Over to you.
Thank you very much, Jide. Very clear. Now, the last question on this particular first round is around data on the COVID-19 security governance nexus. And I think all that data is found in the report, and we have shared a link to the report. So we leave you to browse through the report so that you can be able to see all that data. Now we'll go on to the round 2 questions. And the first question in round 2 is pretty much down our lane as Africa CDC, and I will touch on it a bit. And it is asking about how do we address the post-COVID-19 space in as far as management of pre-existing conditions like HIV, TB, and other conditions, when this is coupled with people shying away from health facilities due to fear of contracting COVID-19. What I can share is, one, there is fear of by users of health facilities to go to health facilities, no doubt about that. What we have done as Africa CDC is providing guidance to governments that they set up facilities for looking after COVID-19 patients to be separate from regular health services. This way, we do not affect the provision of health services, and those should be able to continue while securing either parts of a health facility or a completely new facility to look after the COVID-19 cases. We are still compiling this data on how exactly it is affecting chronic cases, diabetes, HIV, TB, etc., how those are being affected. The preliminary information that we see is that the impact is negative, due not only to to the fear of COVID-19 itself, but also the lockdowns and curfews and restricted movements that have been necessitated by this pandemic. When this data becomes more available and has been properly analyzed, we will be able to share that. But the reality is that there is fear, and we are managing this fear by trying to separate these services and encouraging governments to ensure that stigma is not taking root in the society in as far as COVID-19 is concerned. The second question in this round of question is to you, Jide. The question is, how can we link these discussions to government budgetary processes or deliberations at member state level? Jide?
Thank you. That's a very good question. I think there are multiple entry points that is required. This report is not an end in itself. It's an opportunity for a multi-stakeholders engagement in some of the findings and recommendations emanating from the report. And we hope and anticipate that there would be an opportunity for policy organs like within the African Union, such as the Peace and Security Council and others, to be able to interrogate some of the findings coming out of the report and see to what extent it can be elevated in the whole process of policy formulation and decision making. That's the first regional entry point that we see. At the national level, and this is where, again, UNDP becomes extremely relevant, given our presence in various countries, and given that our country offices were very much part of the reflection that we had or that are contained in the report. We also have the opportunity to begin to strengthen our capacity to support governments based on the recommendations coming out of our briefing. We have, as a way of ensuring effectiveness, in addition to this report, we have also developed individual country briefs for across the countries in the Horn of Africa, where we have proposed specific recommendations that are context-based, that our country offices can use for their engagement at the national level. So this is not something that one entity can do alone. It is one that would require a multidimensional intervention, starting with the role of the African Union. Over to you, Dr. Ahmed.
Thank you very much, Jide. And the third question in this round, I will ask for Ilwad and Mukondeleli to respond to. And the question is the relationship between economic responses, particularly at country level. These include social protection measures and post-COVID recovery packages. When you look at the economic responses and conflict sensitivity, given pre-existing perceptions around corruption and marginalization, what would you say are the key things to look out for in as far as the interlink between economic responses and the conflict sensitivity are concerned? Maybe we start with Ilwad and then we go to Mukondeleli. Ilwad?
Thank you, Dr. Ahmed. I would say that we've already started consulting with member states to have a better grasp on the economic needs, especially when seeking to build capacity of women, considering they're part of the heavily impacted groups. Consultations have also been carried out directly with civil society organizations, and what has come out of this is, first and foremost, the need to have a quick access fund for women and young girls in Africa. We're currently trying to establish this fund within the African Union. This is something that will be quite lengthy, but we do hope that this will materialize very soon. As you said, its impact on women has been very severe and will continue to be so, whether it is in previous health crises like Ebola in Africa. And we will keep on trying to give maximum support to civil society organizations in a very direct manner. That's my first point. This is what the AU is trying to do. Secondly, within member states as such, I shared the guidelines I mentioned earlier. We have advised member states to start by supporting women, women who since the pandemic have lost their jobs, for instance, we've suggested that member states provide wherever possible some training to build capacity and maintain this type of supports and as soon as possible. Let's not wait for the end of the pandemic. We do not know when this pandemic will end. So without waiting to step in and directly support women, knowing that we can expect for the negative impact of the pandemic to worsen and put these women at risk of being in extreme poverty situations. Thank you.
Thank you very much, Ilwad. And now I will ask reflections from Mukondeleli.
Thank you. I think just to build a little bit on the points that were raised by my sister Ilwad, the reality is economic dependency of women on men perpetuates inequality, gender inequality, and also contributes to women's vulnerability to gender-based violence. I think economic recovery and stimulus initiatives that are being undertaken by various member states, in as much as the intention is there and it is good, the reality is our member states are overstretched and will not be able to reach and feed all of us and equally. When we also factor in the challenges of corruption, which have come to light in many, many countries across the continent in the COVID response, it means our problems are even worse than what they should be. I think the most sustainable way to help families and women and children out of this context is to reskill and invest more in enhancing their capacities in response to the new market that is going to emerge post-COVID. But I also think that having dialogues and conversations around our understanding of gender roles and our perceptions of women and men and their roles in the household and in society is also important. I think we should try to use this opportunity of people being in close proximity to each other in confined spaces to start conversations or uncomfortable conversations around socialization and how we change attitudes and behaviors of young men, young boys, but also the acceptance by young women and girls of abuse and violation. But I do think that the choice should not be between contracting the virus or starving. And we need to find a middle ground that allows people to be safe, but also to pursue economic livelihood so that we relieve people of dependency on the state, but also of others in society. Thank you.
Thank you, Mukondeleli. And now let's shift to Ambassador Fred. What is the implication of COVID-19 on implementation of some of AU flagship programs, notably Silencing the Guns, Agenda 2063, and the Continental Free Trade Area? Ambassador Fred. You are muted, Ambassador.
Yes, Fred, we can hear you.
Thank you, Ambassador. We are running out of time. I will package a few in the third round. I'll start with you, Jide. What kind of interventions will be strongly recommended well, this is for East Africa, but really let's just look at the whole of the Horn of Africa. What kind of interventions would be strongly recommended, and what may have worked best for others, particularly if this was captured in the report? Jide?
Thank you so much, Dr. Ahmed. Extremely relevant. I would want to make one recommendation, one that I think is probably the most important. It is, how do we transform Africa digitally? I think this is perhaps the most important lesson that is coming out of COVID. As you know, today, only 36% of Africans have access to smartphones, despite the fact that over 80% have access to mobile phones. I think if there is a collective vision and collective commitment across various sectors to begin to think about how can we translate this or make that expansion from 36% to 80%. This would really be an opportunity that would ensure transformation in Africa's development path. So back to the point that Ambassador Fred made around, seeing this as an opportunity. One way in which that opportunity will be realized is by ensuring that we digitally transform Africa. Over to you.
Thank you, Jide. Very clear there. Now, I would like to ask Mukondeleli this very specific question, if you can be precise and to the point. How can we ensure that countries are designing economic recovery plans to mitigate the impact of COVID-19, that gender, peace, and security perspectives have been taken into consideration? Mukondeleli.
Thank you. I think the best way is to strengthen the policy frameworks around gender considerations. I think if we have stronger gender policies and gender mainstreaming within other policies in our member states, it will be easier to ensure that women's issues and a gender approach is incorporated into policy making and decision making, and of course into programming. Thank you.
Thank you very much, Mukondeleli. And Ilwan, a final question to you is around misinformation. We have seen a lot of misinformation, not only in the Horn of Africa, but even other parts of Africa. How can we address this from a gender perspective during this COVID-19 pandemic? Misinformation, Ilwad.
That is a great question, Dr. Ahmed. Thank you. What we are aiming for when it comes to this topic within the African Union, and this is also something we have requested from the member states, would be, first of all, to try and understand how women are affected, what is lacking, and also the type of information that is currently available on COVID impact on women and young girls. Now, what we're also trying to establish in medium term is to set up platforms, for instance, think online platforms or traditional communication tools such as the radio, which is common household good in most homes. This is how we intend to fight misinformation. This has also been the advice coming from the numerous civil society organizations, coming from the 55 member states within the Union, through webinars, of course. Basically, we've been asked to set up platforms that would highlight the difficulties that women today in Africa have to deal with to keep fighting misinformation. Thank you.
Thank you very much, Ilwad. And we have run out of time. First is to thank the panelists for providing us with some really good presentations and then taking questions for clarification. Second is to thank the participants for availing themselves to participate in this series of webinars today to launch this report. A third is to thank UNDP and colleagues from Africa CDC, Africa Union, for putting this together. We know the hard work that is going on behind the scenes. Fatma, Faith, Ido, doing some very good work of making sure that this meeting was able to be arranged and delivered. Finally is to thank the two organizations for the close collaboration that we continue to have, not only during this COVID-19 season, but before that, and I'm sure even after that. Some more questions had been asked. They will collate them together so that they can be able to be responded to. It is a very topical topic, and I'm sure everyone wants to put in a word, but time does not give us that opportunity to continue. So I thank all of you participants, thank all of you panelists, I thank the interpreters for ensuring that we can be able to communicate, and I'm looking forward to even more joint webinars where we can be able to share more of what is going on around COVID-19, around peace and security, indeed around development of Africa as a continent. I thank you and have a very good and safe day, safe evening, wherever you may be. Goodbye for now.
Thank you.
Thank you very much. Have a good evening.